Hi, everyone. Welcome back to my channel, Nourish Your Crown. We are so excited to welcome a very, very special guest, Dr. Nina Ross here today. And Dr. Ross is a naturopathic doctor as well as a board-certified trichologist with proven expertise and experience helping patients with scarring and non-scarring alopecia. And so today she's going to share her wisdom, her knowledge with us, her passion for helping others. And I have to say first, Dr. Nina, thank you so much, because when I reached out to her, I didn't know, you never know if people are going to reply or not, or they're going to respond. Y'all, she responded immediately. She responded immediately because she is passionate about helping others. And so I just thank you for that. I thank you for your care, your follow-up. I know you have so much going on and you just take the time to help us. So just thank you for that.
Oh, you're very welcome.
Thank
You're very
you.
welcome. Yes.
Thank
Yes.
you. So today we're going to talk about all things related to hair loss and hair therapy, which I love that concept of hair therapy. And we're also going to talk about just holistic living, right? Which is a specialty
Right.
of Dr. Ross. So we want to really go into that, as well as some of the mental and emotional side that we don't really always get to talk about. So we have a lot to cover today. So to get started, plus we have questions. So those of you who ask questions, we got your questions, and she's going to address those as well.
Right.
But to get started, Dr. Ross, just tell us about you. Why become a physician? Or become a PhD? Why become a trichologist? Tell us a little bit about your story and what drew you to this field.
So I always knew I wanted to be in the medical field. So that has always been in my background. Like most kids, first when they have summer jobs, they will have summer jobs working at different places. Like my summer jobs in college was doing research on AIDS and HIV. Mm-hmm. So I was in a medical magnet program in high school, and because I just knew for sure that I was going to be a nurse. Mm-hmm. And because I had so many people in my family that was going to the hospital, and I saw them die, it was just too much. I was like, you know what, this is too much. I want to help people, but I don't want to help people in this type of way. Mm-hmm. So then I started doing cosmetology. But when I did cosmetology, I was working for this big nutraceutical company down in Fort Lauderdale, Florida. So I am originally from Miami, Florida.
Okay.
Yeah, originally from Miami, Florida. And I worked for this big nutraceutical company, and we were big on healing people who wanted to take a holistic approach to various type of diseases or health conditions without any prescriptions. Mm-hmm. So that was kind of like the starting point of my learning. And I was still taking classes for nursing. I was there full time. I was doing hair part time. Mm-hmm. And then corporate America just became a little bit too much, I would say, brain picking, brain picking, and not really moving up on the ladder how I felt like I wanted to. So I kind of left and was doing hair full time. But I noticed that in my specialty that I was getting these type of clients that was trying to conceal their hair loss, because I specialize in hair extensions. Mm-hmm. I wanted to learn more about what was going on, why these women were experiencing hair loss, because it wasn't all just due to traction alopecia. So I took a certified course in trichology. Mm-hmm. And at that time, I was doing a trichology course, but I was in school for naturopathic medicine. And then when I was finished with trichology, I realized that I have the certification, but it was kind of I already knew, and I needed more information. So now I went and I got all this education, but it was still a piece of the puzzle that was missing.
Okay.
And that's where the holistic medicine come into play at. Okay. So in naturopathic school, and then I was also enrolled in another school. So I was doing kind of a dual enrollment for my Ph.D. in functional medicine. Mm-hmm. And my husband, he didn't know about it. So eventually I had to tell him that I was going to two schools. He was like, "You're crazy." But I think I became obsessed with trying to figure out why I kept seeing women with a certain type of hair loss. Mm-hmm. And it just pushed me to kind of pursue my education at a very aggressive rate. And I can honestly say I put myself through a lot of stress with schooling, just because I felt like whenever I would see a client and the diagnosis would be, "Oh, you just have traction alopecia," or you have hot comb syndrome.
Okay.
And, you know, this is clients will say, well, I had this hair loss like 12 years ago. Well, if they would have gotten a proper diagnosis 12 years ago, then maybe we would have been able to save their hair.
Right. Right.
That's how I kind of got to the point to where I am now. But as far as like holistic health, like learning about like nutrition, hormone, which is another specialty of mine, I've known about it for over 20 years just by working at the company Life Extension.
And so to talk about, if we talk about, you mentioned traction alopecia, a lot of the women on this channel have either scarring, some type of scarring or non-scarring alopecia, and
Right.
they're at various stages. So some of us have gone, you know, we've lost it, it's come back. Some of us, you know, it's not coming back, or there's challenges. So can you talk to us a little bit? And there's some like who go on the channel who are like, I want a definition. So can you talk to us and maybe describe like scarring versus non-scarring alopecias and hair loss?
Sure. So non-scarring alopecia is the alopecia where you will have alopecia areata. So that's one where the immune system or something has triggered the immune system and now it's attacking your hair follicle. So that's non-scarring. And then male and female pattern hair loss, that's also non-scarring alopecia. And then you have alopecia such as CCCA, lichen planopilaris, you have folliculitis, which is a scalp condition that can lead to scarring alopecia. You have frontal fibrosing. Those are scarring alopecias. And the difference between the two is that with even alopecia areata, where you see a lot of people, it looks like the circular hair loss and the circular patches. The difference with those alopecias and scarring is that it doesn't affect the stem cells inside of the follicle. When you have scarring alopecia, it is affecting the stem cells. So once the stem cells is damaged, then there's really nothing that you can do to rejuvenate those hairs. So that's pretty much the difference between the two. Now you can have a combination of both. So you can have CCCA and you can have like genetic hair loss or a hormonal hair loss.
Yep. And if anyone's seen the videos for me, I had like a combination of I got the special. Doctor, how do you determine what someone has, and then what type of blood work or lab work? So people who might need to know, you know, what are the lab things that I should be asking my physician, or what are the things that go into diagnosing from a physician's perspective?
So I just want to say, so I am a non-licensed doctor. So there's difference between the two. So non-licensed, however, I do have a medical director. So our facility, I can do pretty much anything that in my clinic that a dermatologist can do, or also a clinic can do with my medical director. But I don't like the word diagnosis, because those are medical terms. And people think that with those medical terms, you're stuck with that so-called said disease. So that's where my view is a little bit different.
I appreciate that.
Yeah, but pretty much the way my process works is that you come in for a consultation, right? And then once I do, some of my clients will have a scalp biopsy, some don't have a scalp biopsy. But I'll do a scalp analysis, and based on the scalp analysis and what I see on the scalp, I can determine what type of hair loss you have. I can determine if you have, let's see, if you're experiencing telogen effluvium, I'm taking a look under the scope. I know how the hair shafts look. If I can determine the way how CCCA looks from lichen planopilaris, frontal fibrosing, which is also a subform of lichen planopilaris. So those two, we're kind of seeing some similarities with those two. So I've been trained to be able to tell the different types by looking at a dermoscope or a trichoscope. But for diagnosis, you want to get a scalp biopsy. And the scalp biopsy is going to tell you how much inflammation is present, and also how much of your hair follicles is still active.
Okay. Yeah, that makes sense. And then in terms of, well, one of the things we had talked about in our pre-conversation was around some of the latest research out, right? Or some of the things that you're seeing in terms of, do you say treatment options, or what? How do you? Yeah. So what are some of maybe some of the treatment options that you're seeing that are out? I know that, you know, we've seen topical metformin kind of come up and be talked about a lot? Where are there any other things, maybe even ones that you've known? Someone made a question. I'll ask this question now, actually. They said, I saw that Dr. Ross helped improve a patient with scarring alopecia. They've seen your videos, they've been following you without steroid shots. Can you talk a little bit about how you helped that particular patient, and knowing, I think we all know, everyone knows everybody's case is very individual and very specific. So we can't put a blanket statement, or blanket a treatment option for everyone. But can you talk to us a little bit about maybe how you helped that patient, and then to start there.
So for me, the way that I think I'm very I would say scientific or anatomy based. So I know if they're like that particular client had scarring alopecia, there was a lot of inflammation. So I'm going to work on the immune system. I always work on the immune system. So anti-inflammatories, free radicals. So these are type of supplements that I'm giving my clients internally. And then the treatments that we use inside the clinic, these are treatments that naturally help to calm down inflammation so that I don't have to use steroids. So a lot of people don't know that steroids are not approved for hair loss. So steroids is approved for autoimmune conditions, but not hair loss.
I think people are going to be shocked when they hear that.
So steroid shots, they're not FDA approved for hair loss.
So they're giving them to people for inflammation.
For inflammation, that's what it's, that's right, correct.
So
the thought process behind it, so it can work. I have seen steroid shots work, and I've also seen steroid shots where the client have lost more hair. There was indentation, there was hypopigmentation, thinning of the skin, and then I have also seen steroids cause scarring. And there are some side effects around using steroid shots, especially with the amount of excessive shots that can be given by some physicians.
And so this is a good segue into talking about treating, and maybe if we can talk about this, what root causes, root causes of scarring alopecia, or you talked about the immune system and alopecia areata, but maybe what are some of the root causes? We know that inflammation is obviously connected to it. I mean, I know, and I'm also very interested in the connection between inflammation in the body. Like, I'm convinced, and I've done it's what's happening in our gut, what's happening, internally, our cells is connected right to what's happening on the scalp or underneath the scalp. Correct?
Right. Correct. No, you're absolutely correct. And that's one thing what I've always preached from the beginning. And I think that's the reason why I tend to get results with my clients. I'm big on nutrition, as far as soon as you have these type of inflammatory scalp conditions or alopecia, I automatically want to put you on an anti-inflammatory diet. So I'm a big component of no gluten until we can calm down the inflammation. The gluten in the United States is very bad because it's red gluten. They put too much gluten inside of the bread, and the body does not know what to do with it. So it turns into mucus. Cheese is very inflammatory too. So that's one of the other things that I kind of keep out of the diet. And then I tell my clients, you do want to keep your carb count low, your carb and starches, because if you're eating too much carbs and starches, that's going to turn into sugar. So all of those things is going to sugar in general, when it breaks down, is going to go where there is inflammation. So if there's inflammation or any form of bacteria, or even scarring. So inflammation can go in, and if you ever had a scar and you eat something inflammatory, sometimes that scar will itch. Yeah. So inflammation will go, the sugar will go where the inflammation is, essentially.
That's good to know. That's good. So does it matter what type of sugar? If it's like naturally occurring sugar that has the fiber,
fruits are always good with fiber, because the fiber helps with the digestion of the fruits. Dates, I like agave. We're talking about, like, just to keep it real, like, like junk food, cookies, and then I'm seeing a big thing right now is, like, a lot of people are consuming a lot of white rice. Like, I hear I gotta have rice with a meal. Okay, is it just for dinner? But there are some people that's eating rice for breakfast, lunch, and dinner.
Okay. Yeah.
That's too much.
Yeah, that's a lot. It's a lot.
Yeah, and you can never, the thing is, when I talk about foods and talk about elimination of these type of foods, it's a process because food can be an addiction. So I don't want to take everything away from you all at once because you won't stick to the program.
Right.
We're going to take baby steps. Yeah. And if you mess up, it's okay. We're all human.
Right.
Start back. Just go back to the program.
Right. That was, we had talked earlier too. Like for me, dairy was the one that I knew for sure because I was having stomach issues plus, the hair issues. And so that one was one. I've cut back on other things, but that was the one that I had to just go cold turkey on it because anyway, I was too sick with it. But so any other tips on nutrition? So I know water is important. We've heard that a lot. Water. Anything else from nutrition that we need to be mindful of?
So, okay. So I just want to say when we talk about nutrition and inflammation and hair loss, health conditions is tied into it as well. So most of what I'm seeing is, and this is looking at, okay, so we're looking at studies that they did on CCCA and these inflammatory alopecias, right? So right now, some of the studies are at one point made sense, but now you look at them, some of them are not making sense. And when I say they're not making sense when it comes to CCCA, because now men is getting diagnosed with CCCA. So first it was, we had a gene and certain environmental factors. Most women who have fibroids will have CCCA. Most people we're starting to see people that have type 2 diabetes will have it. Well, I know the men are not getting relaxers. They're not getting these, I would say, said chemicals that women have been predisposed to. So now what is really causing this inflammation? So that brings me to, I think a lot of it is in some of the foods that we're eating, the cleaning supplies, being exposed to pesticides. A lot of like soaps have like really harsh chemicals in there. And these things causes imbalances inside the body. And when I say imbalances, when I'm doing functional lab testing, I'm seeing the pH balance is off. If I'm doing something called an organic acid test, I can test the yeast markers in the body. I can see how much yeast is in your body. There is a lot of people who are going on like a vegan diet, and then now your levels is low in biotin, which is not good because you need biotin for a healthy gut. I'm seeing H. pylori. I'm seeing a lot of gut issues, honestly, gut issues, high sugar, insulin levels, people with hypo and hypothyroidism that's having these type of inflammatory and autoimmune conditions.
And that's where this actually the exact same thing, different words that someone else was telling us a while back, where our body, like they were saying, the last thing your body is worried about when it's dealing with issues is your hair. So that's letting you know that something else is going on, and then deal with those issues. And the other thing is the hard thing for this, and maybe we can segue into those, even some of the mental and emotional part of this, is that there's a lot of emotion attached to hair and hair loss. And there's a lot of mental, connections, mental things that we experience, whether it's because of the hair loss or it's during the hair loss, or or it triggered the hair loss. Like emotions and the mental side is a huge component of it. Can you talk to us a little bit about?
So yeah, that you really hit on something, because I've had cases where I do see a lot of clients that have some, I would say, mental imbalance, some cognitive imbalances, right? And I've seen some clients that have been put on anxiety medication because they are experiencing hair loss. So it can be very emotional. I've had clients come and consult with me and contemplated committing suicide from losing their hair. There are some clients whose husbands don't know that they're losing hair. And then I've seen cases where there is an unexplainable itch, or I hear at times where people will say, it feels like something is crawling in my scalp. And go to the dermatologist. Nobody believes what these people are saying. And I believe them because, if you hear one person say it, then somebody else saying it, and you're collecting data, these people are not crazy.
Right. Right.
But there's just not a lot of research. I feel like when it comes to these new type of inflammatory hair losses that's affecting, not only the Black community, but also, a lot of Caucasian and other ethnicities have these autoimmune conditions. I flew to London and I was blown away to see how many people was affected by lichen planopilaris and frontal fibrosing, and it wasn't just Black women.
Right.
So that tells you something.
It
But as
does.
far as, mental, it's huge.
Mhm.
It's huge. And what I try to tell my clients, I try to be positive. I try to give them tips on, going out in nature, trying to center themselves. Journaling is really good. Find a therapist that is understanding of your situation and not will push to send you to a psychiatrist to put you on medication.
Right.
Because there's nothing wrong with you.
Right.
So,
Right.
it's really tough because even for me as a practitioner, there's a lot of times where I can't even go home after I consulted with a lot of people. I have to either try to go to the mall to try to like walk it off, or to take a long drive before I come home and bring that energy home, because some of the stories that I hear, it's devastating. So
Right.
that's the reason why I'm in this industry. That is the reason why I feel like I stay up late night and I'm researching, and and I'm not gonna stop. Like I feel like at some point I feel like I'm gonna be the face of CCCA, because I'm not gonna stop. Like I need answers. I want to know the reason why.
Right.
And and I really do think it is because we are exposed to a lot of strong chemicals. I've seen some studies that was done on sodium lauryl sulfate. And I think it was in 2003, and some participants was Caucasians and African Americans, and they wanted to see how the scalp would react to the different concentrations of the sodium lauryl sulfate. And because Black skin did not turn red, they kept increasing the concentration of the sodium lauryl sulfate. It took them 2 years to realize that our pigmentation skin sometimes does not respond the same way that someone of a lighter skin complexion does. 2 years. So that tells you that a lot of products that's marketed to Black women have higher concentration of these ingredients. And then also the products that our other, friends use, such as sunscreen. A lot of white women are losing hair around the front of their hair because of the ingredients in the sunscreen.
Wow. I guess it also speaks to just as much as it might seem tiring, is we just have to be diligent about owning what we're putting in and on, our bodies.
Right.
The idea too, I think what we were talking about, like for the women on this, because I've nothing compared to what you've got, maybe the patients that you've had, but just the emails from the women who are devastated, who are discouraged. And so I think there is a lot to be said for I call them gentle care practices, right? So things that allow you to slow down and to do all those things, to journal, to write, to, even as crazy as it might sound, I think sometimes is like find a hobby. Because I remember I'll say personally, I went into almost an obsession mode, because I was so kind of like, what's going on? I went deep, right? Trying to figure out what was going on. And then at some point, regardless of what I think I saw was happening, was like, okay, I gotta stop.
Yeah.
I gotta stop. Do what I know to do.
Right.
Eat the right things, do the things, but I have to stop. My hair, for lack of a better term, it does not define me, but it's hard.
It's hard. You're
To
talking
actually,
to someone,
to actually really believe that in your bones, right?
That's right.
Time to get there. So I would just encourage anyone, no matter where you are on the journey, it's okay wherever you are. Like, don't.
So, it's true. You're talking to someone who's experienced. When I first met my husband, I was young and I got a bad relaxer. And my hair was coming out in clumps, but it wasn't coming out in clumps all at once. So when we were dating, I would lock myself in the bathroom and I would fix my hair, and he would not know that I was losing hair. And then there was a time where my iron levels dropped really low, and they wanted me to get an iron infusion. Now, this is while I am practicing trichology, and my hair fell out. Was on I think I was on vacation, pulled my hair back, and I was like, okay, my sides are gone. When I tell you, it was devastating, and I knew what to do.
Yes.
And my husband kept talking. He was like, come on, like, you know what you got to do. Now you got to practice what you preach, you know?
Right.
And I keep telling myself, like, you know what to do. You know what to do. But you know what I was doing?
What?
I was avoiding it. I was doing what some of my clients was doing. I was avoiding it, and I was focusing on so much of trying to help my clients' hair grow back to where I was just like pretending as if mine did not exist.
Okay.
Yeah.
Yeah.
So I've been there.
Right. We all struggle in varying ways. And that's the hope even for this channel, is to at least find community, but then also to get, and we'll do this at the end, like just take the next right thing. Don't worry about 6 months from now, 10 years from now, just the next right thing.
Right.
So when it comes to supplements,
okay.
Can we talk a little bit about what's your approach to supplements? What ones do you generally, again, I know we're not diagnosing anyone specifically, but what are your thoughts around supplementation?
So I'm a big component of supplements. I'm big on the quality of the supplements. The supplements that we use, it does have a certificate of analysis, and then also the supplements that we use, a scientist dermatologist has formulated these supplements based on the type of hair loss you have, will determine the type of supplementation that you'll get. So if you have let's say CCCA, and then I find out that you have like a thyroid condition, then you'll get like a combo of an autoimmune condition type of supplement that will address both areas. So as long as the quality is there, I'm big on it. So a lot of people think that you can get your nutrients from your foods, which you can. However, if you are deficient in something, you need to supplement and get those numbers up to optimal levels, and then you can taper off and then get it from your nutrients. There's sometimes it's very hard for you to get those numbers up just from foods. You're going to have to be eating a lot of green salads, especially if you're on a raw diet to get those numbers up.
Right.
And then two, for me, the way I look at labs is, let's say, for example, I did labs on you. I'm looking at how the body is functioning. So if your pH balance is off, or if you're having problems, you're having gut problems, then I'm going to correct that first. Because if I don't correct that, then you're not absorbing the nutrients from the foods that I'm giving you, and you will not be absorbing the vitamins that I give you. So there's a certain way that when I give supplements, it's a process to it, but I am a big fan of it.
Not good. And so then can we talk a little bit about maybe hair care itself, right? Because I've gotten emails about people say I'm doing all these things and I'll get a flare up, or it gets tender, or it itches. So what can we be doing in terms of our hair care, right? Just basic hair care practices, hairstyles, again, everybody's individual, but things we should avoid. And then the one specifically is around micropigmentation. We had that question before, like, what are your thoughts around that?
Okay, so let's touch on the micropigmentation. So if you have a type of autoimmune condition, hair loss, if you have alopecia areata, or if you have hair loss where there's inflammation, then I would not suggest getting micropigmentation. Now, if it's to the point where you just have only traction alopecia with no scarring, because you can have traction and with scarring. If you have traction with no scarring and then you want to go and get the pigmentation, you can. But with the other conditions, I do not advise it. It's a possibility too that the skin may push it out. So, and that's also if you have an autoimmune condition. So if you're diabetic or you have a thyroid condition, then you're really not a candidate for scalp pigmentation.
Okay, thank you for that.
And then as far as hairstyling practices, so if let me address I want to address the two, because I feel like I always leave out the other community. So as far as Black women, as far as hairstyles, once the inflammation has calmed down and the foundation of your hair is healthy, you can wear your hair natural, like how you're wearing it. You can do two strand twists. I have actually had clients that was able to get micro locks because the inflammation, we had got the inflammation under control. Sister locks, I've even had clients who had sister locks, they broke off, we got the hair back in a healthier state. The loctician was well versed in helping to care with the client's hair. I don't advise crochet hairstyles just because you have to braid the hair down and then you have to, tie, do the tying method. And in addition to that, because of the data that I've collected, I have seen CCCA and other inflammatory scalp conditions and hair loss get worse from that hair. It has so much chemicals in it. The hair is synthetic, and with it touching your scalp, you're sweating. Just imagine those chemicals is getting inside of your hair follicles.
Just
A lot of the
inflammation
products, a lot of the products in these fake hairs that's sold to us in a beauty supply store, the makers of these things do not care about us. They're in it to make money. The beauty industry is just as bad as the medical industry can be at times.
And in terms of, there was something I wanted to, PRP, someone had mentioned about PRP as an option, because I'm in a CCCA group, and I feel like I haven't seen a ton of people saying they've had major success with it.
Right. So we do PRP in our clinic, and most of my CCCA clients, I don't give them PRP. Because here's the thing with PRP is that you have to make sure that there is no inflammation, that the inflammation has calmed down, because you can cause a shedding storm. So someone can lose more hair. So for me, I don't like to gamble when it comes to my clients' hair. I want to try to preserve every hair strand that I can.
Right.
So that's why I don't use PRP. There's other things that we use that's just as good. There's exosomes that's out. That's still, there's still research around it. You can use it for other types of hair loss. But right now, it's that's something that's not being offered for clients that have CCCA. Now, what I typically do is for my clients that have CCCA, I treat you for CCCA as well as hormonal hair loss, because I do think that CCCA does have some type of hormonal component to it, just because, it will start out in the center and it'll start to move forward. Or when you have hormonal changes, you go through menopause, that's when I start to notice it starts to accelerate, as well as frontal fibrosing. So that's where you get the thinning around the perimeter. And that's really important too, because a lot of women are getting misdiagnosis and saying that, oh, you just have traction alopecia. But see, once you have removed those hairstyles, if you were wearing those tight hairstyles and it's still progressing, that's not traction alopecia, and that's where you need a scalp biopsy.
Right. Yeah, mine's, and I said this in one of the earliest, mine started here, but I was also menopausal, right? So so it's like a perfect storm of all these different things, happen.
Right. Yeah.
So maybe can we go to some of the questions?
Sure.
Okay. So you actually just answered that one. Is microneedling the same as micropigmentation? Is that the same thing?
Two different things. So micropigmentation is where they're actually, it's almost like a tattoo on the scalp.
Okay.
Yeah. Microneedling. So there's different types of microneedling. So there's microneedling with actual needles, and then there's microneedling which is called a nano pin. So there's actually no penetration on the scalp.
Okay.
And so when we have clients that have CCCA, we don't go in with 12 pin needles because we don't, that can be really aggressive and cause more hair loss. So we're doing nano needling on them, or we're using a device. It's called like a no needle device. So it can actually push any type of growth factor that we're using into the dermis of the scalp.
Okay. So that's the question was, should they wait to do microneedling with growth factors, which is what you said, once the inflammation has died down? That was
right. So, and that's with a professional. So a lot of people are looking on YouTube or seeing videos with people using the derma roller, and they're derma rolling with oils on their scalp. That's something that you shouldn't do, because that's going to increase more inflammation. And then derma rolling with the roller, it's like you're not creating the punctures that you're creating is not consistent. So you can actually cause more trauma to the scalp by doing those things. So you should really seek a professional when you're doing that.
Oh, I didn't know that people were doing this at home. I didn't
Oh
know
yeah.
I didn't know that was a thing. Okay. Um, so one of the other questions was, we kind of talked about this a little bit, but if there's anything else you wanted to add, when they said, the person said that they saw that you helped the person with scarring alopecia, and what did you do to encourage growth? And I think you kind of touched on that, where you really looked at their anti-inflammatory, or
so it's okay. So all 98% of my clientele have some form of inflammatory alopecia or inflammatory scalp condition. So I have a lot of CCCA clients, lichen planopilaris clients. And my approach is always, I'm doing blood testing on them. A lot of times I may do a biofeedback test. So biofeedback tests can detect parasites. It can detect candida. It can detect certain things that you wouldn't think of to test. So I'll do a biofeedback test first, and then that'll be my guide to kind of see what type of labs I want to run.
Okay.
So the labs is really the trick to it, because I'm running labs that you're not getting from your doctor because the insurance company will not pay for these specialty testing. So I'm able to see what's happening inside the body, and then I know what type of nutraceuticals to give you. So you're just not getting like a proprietary formulation like a Nutrafol. You're getting therapeutic dosage of certain type of vitamins to address certain inflammatory issues or things that come up. Right. And then the topical treatments, like I said, I have various type of growth factors. So it just depends on the stage of the CCCA, the condition of the scalp, the age. But like I say, I have so many before and after pictures, and that's how I know it can be done without steroid shots, and it can be done without taking doxycycline too, to calm down the inflammation.
Right. So everybody hear that out. Listen to that.
Oh yeah.
So, what do you you actually just talked about this. What do you think of using maybe a wooden roller to massage the scalp?
So to a wooden roller. Okay. So I'm not sure about a wooden roller, but you know what I would suggest? And help me with the terminology. So the jade roller that you use on your face? So they actually have like the bigger ones. They're really big, that you can use on your legs. So in the back of your head back here, you have a drainage system here that helps with toxins. So you can actually use that tool back here, and you're actually helping to remove toxins from the scalp. Yeah, you have a drainage system here too, like your lymph nodes here. So a lot of times I'll tell my clients to do like this too, to kind of help toxins flow here. But oh yeah, you can totally do a lymphatic drainage of your scalp. Oh yeah, especially for my CCCA clients, definitely.
That's the first time I've heard that.
Oh yeah,
that's the first time
I actually learned that from this woman. I called her like my I would say my spiritual advisor. When I'm overloaded, I come consult to her, and I talk to her about some of the things that I'm experiencing and holding on, like different emotions from my clients. And then she told me, she was like, a lot of people think that the pineal gland is here, but it's actually back here. Which makes it interesting, because if the pineal gland is back here, and then you have a drainage system back here, why does CCCA start right here?
Right.
Why would you have when you have diabetes, or your A1C or insulin levels is up, back here starts to thin? So these are some of the things that I think about. I'm obsessed with this stuff.
So listen, me too, because listen, I've been looking at these articles, just learning more about insulin sensitivity. Right. And so I'm like, there's gotta be a connection there, right? I don't know what it is, but I'm like, so there, because especially if you look, I'm about to geek out on this a little bit, but like I think there's an emotional mental component 100%. But I also think, if we think about women, and a lot of us now, I don't have like type 2 or anything like that, but if I don't get under control, I don't want to head there either. But there's something about this insulin sensitivity or insulin resistance, that I would love to see more research on that because there's got to be a connection.
So there is. Okay, so when you have, so a lot of women who have PCOS, right? So the high androgen hormones. So most people that have high androgen hormones is prone to having high insulin levels, right?
Mm-hmm.
And when you have high insulin levels, you are more prone to inflammation.
Mm-hmm.
You have a higher risk or being diabetic than someone who don't have high insulin levels. And how does that happen? So that happens because I think within a 3-month time span, it's like your glucose levels keep spiking. Mm-hmm. So it's like if it keeps spiking during those 3-month period, it's going to increase those insulin levels, and then possibly it can lead to you having, early stages of being pre-diabetic.
Right. Which is why so many of us have reduced excess sugar significantly, because even though we may not know the science behind it, we know that if we go overboard with it or keep too much, it certainly impacts. It
can impact your hair, it can impact your health. And then what a lot of people are not aware of right now is that it can infect your cognitive system. It can mess up your serotonin levels, your dopamine levels up. So a lot of people that come very emotional or sad, you see these range of emotions, especially in young kids. When I sit down with the parents and we talk about, okay, the diets,
mm-hmm.
it's high in sugar.
Mm-hmm.
Yes.
Mm-hmm.
And sugar is also leading to, I have young kids who have alopecia areata from being on a high sugar diet, high sugar and fast foods.
That's so. This is what I meant to say earlier about our cells. You and I talked about this, and I said that our cells. This is from the mental emotional side, like how our cells hear what we're saying, right? So it's really, there was you said it, I read it in the scientific journal, but like what we think and especially what we think and what we say are so important to us. So we speak healing.
That's right.
Health. We speak healing and health.
That's right.
Everyone listening to this, and that we will have the fortitude and the resilience to do what it takes, even one step at a time, to get us to who we were ultimately designed to be.
That's right. That's right. And I wanted to say something too, is that, I know you focus a lot on women that have scarring alopecia, but also the women who are experiencing hormonal hair loss. And with now you can just go online and they'll give you finasteride and they'll give you these minoxidil concoctions. You really want to be careful, and you really want to get your hormone levels checked. Right. So you want to be able to see, okay, what's happening inside of my body. And you can take a holistic approach to get your hormones balanced, or you can do compounding hormones. But you need to do the two together, because topically is again, once you stop using those products, your hair will fall out. Finasteride, if you are still in bearing stages, it can cause side effects. So it's not advised for women to take it. But again, it's being used on the market. But if you are experiencing or you have a diagnosis of female pattern hair loss, or they say androgenetic hair loss, please get your hormones checked. That's an inside out approach.
So listen up, everybody, including me. So, so let's see. I think I got I'm looking at all the questions here. Microneedling. So one other question was, you actually kind of touched on this, but how long do you recommend that a patient get steroid shots? And you kind of already recommended. Oh, this person said, how long do you recommend getting steroid shots? And I wonder if I'm going to have to get them indefinitely.
Okay, so indefinitely should definitely be a no, and the dermatologist should advise. So typically the rule of thumb, I think, is six rounds.
Okay.
Because it does have side effects.
Right.
And keep in mind, there are some countries that do not give women steroid shots. Remember, they're not FDA approved. So if you can do like a topical steroid versus the steroid shots, that's a more healthier alternative. No, I can say that I have seen clobetasol work just as good for calming down the inflammatory factors of CCCA. So you don't have to do the steroid shots.
Yeah. That's what I use, the topical one that they say doesn't go into the bloodstream. And I use, so that's the one that I use. And I only had to use it I mean, I had the same bottle for over a year and a half. That's how little I used it, really.
Right. If
But
you change your diet,
that's what
and
happened.
yeah, you can all of those symptoms and the itching and the burning and the tenderness and keep the oils off of your scalp.
I was going to ask you about that because I had someone ask me, like, you never talk about oils and things on your scalp. I don't use them.
Yeah.
I don't put anything on my scalp. I mean, I'll use a massager, like the electric massager, but the times that I have used it, I'm too inconsistent anyway. But I just use, it's
your hair needs more water than anything, because a lot of times with these inflammatory alopecias, it's attacking the sebaceous glands. Mm-hmm. So the reason why your hair and your scalp or the texture of your hair has changed is because it's destroying the sebaceous gland and the hair shaft. So that's what we call it professionally. The hair shaft is what you see. Mm-hmm. The inflammation is trying to destroy it. So I don't care how much you oil your hair, it's still going to feel dry, but it is keeping the inflammation there. So I like to tell my clients, if your hair, gets dry, you can get a little bit of water, put a little bit of olive oil and do a spritz on the hair, but nothing on the scalp. I like to use water-based treatments on the scalp, not oils, not the rice water, none of that stuff.
Okay. Yeah. There's a lot of that. And I say all that to say, because I know everybody has their preference. I know there is a thing about the placebo effect too. So if it's working for you,
right, exactly,
do you, because there's the placebo effect is sometimes if you believe it, it works. And so if that so this is I think everybody has to find, like, we respect everybody's approach and everybody find the approach that works best for you. That's the overall message here, because
but if you are finding that you're getting bumps on your scalp, and your scalp is itchy and you are using oils on your scalp, pull back and see what happens. Mm-hmm. And if your scalp has become itchy, it's okay to take I like to use a makeup instead of a cotton ball, like one of those makeup cotton balls that you can clean your face with, which is witch hazel. Straight witch hazel. I like to go in and just clean the scalp with it. It's a really good astringent. It's non-drying, and it can definitely help to soothe the scalp with some of the itching feeling. But like you say, to each his own. But I'm not a fan of going in with the greases, the sulfur-8s, and things like that. And the reason why, people, is that those ingredients that was used when our parents or grandparents was alive does not have the same chemicals in there. So the whole chemical makeup is totally different. Mm-hmm. The blue magic is not the same blue magic.
Right. It might have been real sulfur-8 back then. Now it's
exactly. You're absolutely correct.
Yeah.
Yes.
So I think that so the last question was, will you consider coming down to South Florida? Because you're in Georgia, right? Somebody wants you to come.
I am in Atlanta, Georgia, and here's the thing: I have clients all over.
That was my next question.
I have clients in other countries. I have clients in other states that consult with me virtually. As I do go to South Florida to vacation because that is my hometown. But I do have a sister clinic in Tampa, Florida.
Oh, okay.
So my peer, we do work hand in hand together. We share our cases together. So if someone is in the Tampa or Orlando area, I could definitely help them out with that. But I do virtual consults from all over.
Awesome.
Yes.
So, go ahead. Go ahead.
Oh, and we pretty much customize our in-clinic treatment plan. So where you don't have to be in the Atlanta clinic, everything is customized where it can be delivered to you with video instructions on how to do your treatments.
Awesome. That's amazing. So for everyone, we're going to plug all of her information in the description box. Please go to her YouTube channel and follow her. Do you have any other socials that you want to share? Or
so YouTube, my Instagram page is Nina Ross ATL. And then my TikTok, what I just started on TikTok, is Dr. Nina Ross.
You're about to blow up on TikTok.
Yeah. Yes.
I'm calling it.
And then you know what too? If you guys are in the Atlanta area, there is a conference that's taking place next Friday and Saturday, which is called BaldyCon. Okay. And it's important because these women have various types of hair loss. whether it's autoimmune related or they just wanted to shave their hair bald, their hair was thinning. But if you're struggling with, you know, just the confidence and the mental or being unhappy around it, this is the type of event you need to be at. These women are very encouraging, very powerful, loving women. It's a great community. I would advise people to even go onto her Instagram page because she has someone that's a motivational speaker. We need a community to actually help, you know, women and men, because sometimes, like I said, a therapist, if they're not going through it, they don't know how to help.
Right.
Yeah.
And a lot of people, sometimes it's just, like you said, it's just knowing that somebody, you don't have to even go into all the details of it. They can just look at you or listen to you and know that you're in it with them.
Definitely.
Sometimes we just need to know that somebody else is with us.
Right. Even my hair pullers, you know, people forget about them. My hair pullers, like it's because of stress. It's because of anxiety. It's because, you know, they're experiencing some type of trauma. And they pull their hair. Now they get inflammation too on the scalp.
Right.
You know, people forget about them and think that, you know, there's something, you know, cognitively wrong with them, but it's not. You're not getting to the deeper issue.
Right.
There's things that you can do to help. Like, I'm a big fan of NAC, guys. So that's N-acetylcysteine, NAC. So if you are a hair puller, there have been studies that have shown that it will actually help you.
Oh, can you talk about the tyrosine?
So yes, so tyrosine is an amino acid that is really good for helping to calm down inflammation. So if you have a inflammatory alopecia such as CCCA, lichen planopilaris, frontal fibrosing, or if you have androgenetic alopecia, or we're talking about like various types of scalp conditions, tyrosine is really good. I'm a big fan of tyrosine. I've used black cumin seed oil for years. These things are really, really good, along with diet change for helping with inflammation.
Okay. So this was a lot. And
disclaimer, if you have a thyroid condition, you cannot take tyrosine.
Okay. So can you talk to us a little bit about rosemary oil?
Okay. So I know rosemary oil has become very popular. And I'm also seeing a lot of clients come in that's using rosemary oil, and I won't name any brands. But if you have inflammation on your scalp, rosemary oil can also cause more irritation, the oil, especially because sometimes the concentration of the oil, the essential oil, is too much for your scalp. So it's better to get fresh rosemary leaves, and you can boil the leaves and take the water once it's cooled down, and you could do a rosemary rinse, or even take the rosemary and put it in a spray bottle and do a rosemary spray on your scalp. You'll get way more benefits than that versus using the rosemary oil on the scalp.
That's a good idea. So you could also do the same, like maybe with nettle, because I read about nettle.
Nettle too. Nettle
is do like a rosemary, nettle. So here's another one I saw, clove.
Oh, clove is amazing.
So you could do your own little spray and then do
exactly. Now we're getting to herbalism. Definitely, you can definitely do that. Yes,
I like that stuff too. I'm geeking out.
Oh yeah.
Okay, so that's good. That's good.
Yes,
that's good information.
Oh yeah.
Yeah. And always, as we always say on this channel, consult with your healthcare professional, whether it's Dr.
We are
Nina
not diagnosing or anything here.
Right. Get your next step, or your go to your doctor, your physician, or your healthcare professional, or both, dietitian, all that.
Right. And I do at times work hand in hand with my clients' physicians. There are some great physicians that love to collaborate with holistic doctors. And, you know, I think that's the best of both worlds. More people should advocate for that.
Yeah, that's a great idea. 2 to 3 things that you recommend are best next steps for people, regardless of where they are. Oh, I did forget one other question about the stages of CCCA, the different types of, because you could have like early scarring, which is what I was diagnosed with, and then the further stages. Can you talk quickly about those? And then let's go into the maybe 2 or 3 things that you say, regardless of where you are in your hair experience, you should be doing.
So, okay. So some of the beginning stages of CCCA can be where you just notice that this crown area is getting shorter. It will not grow. And sometimes there's no symptoms, right? So that's kind of like the starting point.
Mm-hmm.
And then you have the stage where your scalp has become very itchy. So sometimes it's diagnosed as you have like seborrheic dermatitis, or it can manifest as a scalp condition.
Mm-hmm.
And then I would probably say about stage 3 is when you actually start to lose hair and the areas start to thin.
Mm-hmm.
And then from there, it can progress, and you can actually, if untreated, it can turn into scarring. So if you catch it early, and the follicle and the stem cell is not disrupted, you can rejuvenate the hair in the early stages.
Okay.
And sometimes you can, I want people to hear this. Sometimes you may not see hair, and you may think you have scarring, you don't, and it can be revitalized. I have had cases where, and I have been in high level conferences where we're slowly starting to see, like, once some scar tissue has been thinned out, that the follicle was still there and some hair is growing. So I always tell people to think positive, be optimistic, because the future, they're just now starting to touch and figure out like what's going on.
Absolutely. Absolutely. Okay, and now the last question is, what are the attainable, not too far of a reach, what are the 2 to 3 things that you think we should be doing?
As it pertains to just hair loss, or
Just hair loss, I'm sorry, yeah, in terms of hair loss. So there's so many people on such a range of kind of spectrum in terms of but there are some basic things that what are the 2 or 3 things that we should be doing on a regular basis, regardless of where we are, that can help us on this healing journey?
Okay, so definitely, I think we should get back to shampooing. That's huge. I hear a lot of people that don't shampoo. We're doing a lot of co-washes. So the scalp needs to be in a healthy state, a healthy environment. And then there is some new research that's coming out too, that's showing that a lot of the shampoos that's just, let's just say, like, it's so clean, is not really removing some of the bacteria off of the scalp. So you want to make sure you have a healthy scalp. Number 2, please, everyone, we need to go to the doctor regularly and get checkups to make sure that our health is in order. And then, because the hair loss is an indication that something is going on. So if you know it's not because of your hairstyling practices, but if you are thinning around the top part too, go get your levels checked out. And we need to start telling the doctors, because most of the time they're not doing thyroid panels. They're not testing vitamin D levels consistently, and they're not doing ferritin testing in your annual checkup. So you want to be able to demand those. And then if you're seeing thinning at the top area too, stress that you want your hormones checked. So blood testing. And then most importantly too, we got to really work on our diet. We have to work on our diet. And last but not least, because I think it's 4 things, is that let's do less. Let's start putting less products in our hair. I know on a natural journey, people have like so many natural products. I'm putting this leave-in conditioner, and I'm putting this in and seal this in and that on top of that. We never used to do that. So let's get back to the basics.
Right. I hear you. That's really good advice. It's practical advice. And let's make sure again that we all follow Dr. Nina on all her socials. Get on that YouTube channel. She has a wealth of information there. Like, you definitely can learn even more there. And then also, if you're in the area, or actually even if you're not, check out her practice. I mean, you're taking patients now, right?
Oh, I definitely am. Yes.
So she's taking patients. And I just cannot thank you enough for investing in us and sharing your gift and sharing your wisdom with us. Thank you, Dr. Nina, so much.
Oh, thank you. You're so welcome. I feel like this was my calling. So I just every night I journal and I ask God to just give me more wisdom, because I truly want to help. I really do.
Yeah, you are on a mission. We are your mission field, and we thank you. We thank you. We thank you. So thanks, everybody. See you in the next episode.
Bye-bye.
Okay.